My name is Christina Adams. I'm a cardiologist. My interests include general cardiology, preventative care, secondary prevention. I really have a unique interest in preventative cardiology. Knowing that 90% of heart disease is preventable, I believe if we attack the risk factors that cause heart disease, we're more likely to be better able to prevent disease in the first place. I got involved in cardiology when I was a third-year medical student when my father passed away unexpectedly of sudden cardiac death. And he was my first example of a heart patient, someone who wanted to live a life and was so productive and yet had a very serious condition. And seeing him struggle through his diagnosis and seeing him cope and seeing how much a heart patient doesn't need to be defined by their disease, said this is the role I need to play. I need to become a cardiologist. I need to give back to the type of disease that my father suffered from. Just brought such a truer meaning of why I needed to become a physician. I've been practicing now since 2012 in cardiology and did my fellowship at Scripps Clinic and then stayed on after fellowship. Integrative medicine has always been an interest of mine because it's part of being a regular cardiologist. Integrative medicine is a way to use complementary forms of treatment. Massage, meditation, Chinese medicine, herbal medicine, Ayurvedic medicine. The benefits of taking that integrative approach is just more treating the individual as a whole and looking at multiple ways of attacking a health issue. It just gives us a more of a individual approach to patients and opens our eyes to other possible alternative therapies. One of the things we're offering at Scripps is a unique experience in the Women's Heart Center, which was just launched in 2017. This is a very comprehensive visit open to all women, whether they're just trying to prevent heart disease or look for secondary prevention or a second opinion in regards to total and complete comprehensive care for their heart disease. It's a unique clinic experience, meaning that we take a lot of time with our patients to know their back history, to obtain any necessary testing before the visit so that patients leave with a true understanding of where their risks are in regards to heart disease and what they can do to become healthier and decrease their risk of developing heart disease or developing a subsequent event. It's been an example of where medicine needs to go. Patients in my clinic are challenged, I think, because as a cardiologist, I have certain expectations that my patients will understand what their disease process is, know why they're taking their medications, be proactive in their health. It's a team effort. I work with them to say what's working, what's not working, what's preventing you from getting the exercise you need, what's preventing you from eating a healthier diet, and so that we can get over those hurdles so that people feel overall better. So my patients can expect to have a good conversation about how to improve their overall health, understand their disease process, and really set clear goals as to what we're working for in regards to their heart health. Of course, I do expect them to eat well, exercise regularly, but I would never ask them to do anything I'm not doing myself. I truly believe in practicing what I preach.